Welcome to the Trevor Donald Experience, Manifest Your Truth. And I'm going live with you today, coming straight out of St. Louis, Missouri. And we are having an extreme heat wave that has taken place for the last week. It's going to follow through into next week. So folks need to stay safe and stay hydrated. But I wanted to do a live tonight talking about Trump's big, beautiful bill that is going to cut Medicaid severely and is going to affect millions upon millions of folks. It is very important to know the power of your vote, but what's more importantly, before you vote, is to know how your politicians are legislating. Many times we vote blindly. I do know people of color, Democrats, vote along identity politics lines based on that their family has been Democrat for years, or here recently through Obama and then Kamala Harris, people are voting just because an individual is of a certain hue and or looks like me or you. But you had a lot of folks that voted for Trump, a lot of Hispanics, a lot of white women that voted for Trump along those lines. But people have very seldom paid attention to the power of the pen and how they legislate. And I wanted to talk about one of the things I think, Trump has been big into these governmental waste agencies and cutting them, whether it's been USAID. He's even tried to go after FEMA, but mind you, he did not shut down FEMA, thankfully, because here in the last year and a half to 2 years in America, we've had at least three historic disasters. You had Hurricane Helene off the coast of North Carolina and the East Coast all the way to Florida. They caused severe decimation and destruction, billions of dollars. You had the wildfires in LA County that caused billions of dollars of destruction. And right here in St. Louis, where I'm at, we had a tornado that hit the city of St. Louis, where a tornado has not hit the city of St. Louis in over 70 years. It caused over $1.6 billion worth of damage and 8,000 buildings destroyed, and there were several people that lost their lives. I live in St. Louis, and I had just left my home and missed it by 30 minutes. But yes, my home got damaged severely by it, and this is the first time I've ever been part of a natural disaster. So I'm glad that FEMA did not get cut. But we need to talk about this big, beautiful bill. Is it really beautiful, or is it a horrendous enactment on our U.S. tax-paying citizens? And for those who have not dove down into what this big, beautiful Medicaid bill is, it doesn't seem very beautiful to me. It talks about President Trump's tax bill that will cut Medicaid for millions of Americans. And by the way, this is not a race issue. There are more white folks that are on Medicaid and what you would call the welfare system, food stamps, than there are people of color, primarily because there are more white people in America than there are black. But we need to go take a deep dive into this big, beautiful bill. And for those who haven't followed it, and the Senate is in alignment with President Trump. And remember, your congressmen and your senators are the people that you have voted for that are in office. So you just can't blame Trump. You have to blame your senators and your congressmen that are going in alignment with Trump. And so it talks about here, let me get my little light together. The Senate cleared recently President Trump's domestic spending and tax bill that will enact steep cuts to the nation's safety net healthcare insurance program for low-income families. Now think about it. Most of the people that here in America are middle income to low income. That is the heartbeat of America's fabric. And him wanting to cut Medicaid is going to what? Hurt and affect the main workforce for the survival of our economic system. And this is not a race issue because, as I said, Medicaid, this cut is going to affect more white folks than black. So I don't think that, they talk about Trump with this race play and all of this kind of stuff. I don't think Trump cares. I think Trump doesn't care about middle class and low income individuals, no matter what color you are. And this big, beautiful bill is a big, beautiful bomb. And I think it's going to affect many people. And there are going to be a lot of lives lost as a result of this. And I want to talk a little bit about that and get your thoughts on it. So in addition to him delivering these tax cuts and his increasing immigration enforcement, what Trump has called as the big, beautiful bill would cut nearly $1 trillion from Medicaid. So remember, with Doge, with Elon Musk being a part of it, they were totally concerned about governmental waste with a lot of these alphabet nonprofit organizations. He went after USAID. He was going after FEMA for a while. And there's been cuts at the IRS. And there's been a trickle down effect by it. But I think him cutting Medicaid is the absolute wrong thing to do. So he wants to cut nearly $1 trillion, which is a state federal health care program for low-income families and the disabled. So you really have three machinations taking place here. You have Medicaid that's provided for low-income families, definitely for disabled people, because if you're under 65, you can get Medicare and have Medicaid. Remember, Medicare is for 65 and over if you're healthy, but you can get Medicare if you are labeled as disabled and Medicaid. And I'm going to talk more about that because those two components are very important when it comes to people that live in residential care facilities, assisted living, nursing homes, and those kinds of facilities for people to live in. They say this bill is projected to eliminate insurance coverage to almost 12 million people over the next decade. And remember, the Senate is behind him. So this is not just Trump. You need to be mad at your senators. We need to hold our Congress people and our senators accountable. If this is an actionable reaction and effort that Trump has initiated, but the Senate is behind it. And your senators represent your state. And they're saying that another 5 million could lose their coverage if Congress doesn't extend the COVID-19 pandemic era tax credits. So you got the Senate and the Congress involved in this. This is not just Trump, even though he's the initiator in this. It says that the legislation amounts to the biggest rollback in health care coverage in the history of the United States. And that the balance of it, I think, is it's a callousness on Donald Trump, President Trump, and how he feels about middle class America and definitely low income America. There's a certain arrogance and hubris about President Trump that he can't relate to the average person. But that was also the effect on why I think Trump partially won the race, because the Democrats dropped the ball. I didn't think Kamala Harris was fit for the position. And then the Democrats tried to placate to black, wealthy millionaires and billionaires such as Oprah Winfrey, the entertainers that were involved in Kamala Harris's campaign. You had Beyonce, you had Cardi B, Gayle King, you have these individuals that have, as Democrats, financially, have basically out economically pushed themselves into a Republican lifestyle based on their finances. Um, and can you be a rich Democrat? Of course, but the entertainment industry has, you see, it's being decimated with the Puffy situation, R. Kelly, Bill Cosby. People are starting to disassociate themselves with these entertainers. Will Smith and the things that he's gone through. A lot of these black entertainers have gone through quite a bit. And there's a lot of fakeness involved in the entertainment industry. And are they relatable to the average citizen, black or white, in America? So a lot of these rich Democrats, on an outward appearance, they look and appear to be Democrat based on race or whatever, say Oprah. But on an inner standpoint and a banking standpoint, they basically live a Republican life. Oprah does not live a truly black democratic life. Barack Obama and Michelle Obama do not. They're living in multi-million-dollar mansions, private planes, gated communities, etc. So the Democrats have to find a real base, and at some point they need to find a leader. I'm an independent, but this bill is going to, if this gets passed, and it's going to be trickled down over the next few years, so by the time it takes its full effect, Trump was smart enough that he won't even be in office. So as it has its full effect, and when people finally see the results of this by losing their Medicaid benefits and food stamp benefits, who are they going to point the finger at? Trump will be at Mar-a-Lago and well and gone. But listen to what Vice President J.D. Vance said about it. He casted the tie-breaking vote on July 1st to pass the Senate Bill 51-50. And in a social media post, he said the Medicaid cuts were immaterial compared to the savings the bill will fund through bolstered immigration enforcement. He called it immaterial, like individuals that are on Medicaid are not even real. There will be no substantive effect behind it. So for those middle class, lower middle class, white, black, whatever color you are who voted for Trump, this is a scenario where you're getting a slap in the face. Tell me what you think while I'm on this live, and you need to do a deep dive. Reading is fundamental. The day you stop learning is the day you stop living. And there are things that are going on with our politicians each and every day that have a harbinger and a barrier on your freedoms for your future. And so how will this legislation cut Medicaid? The legislation says it requires an able-bodied Medicaid recipient to work 80 hours a month or qualify for an exemption. So you got to work at least 80 hours a month. And the exemptions would be such as being a student, a caregiver, or having a disability. And of course, you know, if you have a disability, you also can get Medicare if you're under 65. The original House version limited the work requirement to low-income adults without children, but the Senate version added the working requirement to parents of children older than 13. It says that the health policy experts say more frequent eligibility checks are going to be required. So if you've been on, if you have Medicaid and food stamps, so let's say Medicaid, normally there's a one-time a year eligibility check, just to make sure what's going on with you and where you're at. But now they're going to make it twice a year. So that's going to add more red tape, more administrative costs, and will cut people off who qualify but fall under the cracks because of administrative miscues. So while they're saying they're going to save $1 trillion, they're still going to add to administrative costs. So how is that going to, you're going to have more people involved in the administration of it, because now they're going to have 2 checks a year to see if you're eligible for Medicaid versus 1. And so you're going to have to add more people. It's going to be more cumbersome, cumbersome, and we know the logistics to governmental agencies and the logistics to it. If you ever had to deal with city politics, taxes, or city government or state government, let alone federal government, for example, what St. Louisans are going through with FEMA, the Red Cross, for this tornado that took place on May 16th, you have to have an innumerable amount of patience. Things are not going to happen very fast, and there are a lot of roadblocks and doors that have to be opened just for you to even get a few dollars. Because for here, during a tornado, the Red Cross gave each person $350. What can you do with $350 when you had $30,000 or $100,000 worth of damage to your home? I mean, just to get a roof put on, the average house would be over $10,000. Now, should we not take the $350? Absolutely, but that's just a drop in the bucket for the amount of monies that you need to actually restore most of these homes that have been destroyed here in St. Louis, Missouri. But there's also going to be a trickle-down effect. So not only are you going to have millions of people that are going to lose their Medicaid benefits, and remember, Medicaid benefits are also associated with food stamps, with SNAP. So there is going to be a food source deficiency in this sort of situation. It says that, so how do hospitals and doctors, what do they think of the bill? Said Medicare insures 83 million low-income children and adults, according to KFF, a health policy nonprofit. That means that represents more than 1 in 5 Americans who have Medicaid and SNAP. Health policy experts have warned the cuts could harm rural hospitals and doctors who serve a higher percentage of people enrolled in Medicaid. So here it is where the color barrier, or there's no designation or delineation between color. The rural areas, you're going to have more white folks. The urban areas, you're going to have more black folks. And you're going to see that there's going to be a similar negative effect. So rural white America primarily, urban inner city black America are going to be severely affected by these cuts. And if these individuals lose their Medicaid, what does that say for the health propensity for a healthy society? There are a few pillars that have to be a framework for any society to exist. What are some of those pillars? You need healthy school systems. You need a healthy public safety system, police officers, firemen. You need healthy hospitals. You need healthy grocery stores. I mean, think of the things that are needed when suburbia took off in the 70s and the 80s. Those are the components and the tenants that needed to be in place in order for people to move out there. So if we have a broken and a fragmented healthcare system based on these Medicaid cuts, then we do not have a healthy system or a healthy society. And you're going to see there are going to be many lives lost and people are going to die. Many poor people, black or white, do not go to the doctors on the regular, to their doctors on a regular basis. They go for emergency basis. Certain segment of society has a fear of doctors and all of that kind of thing, and but at least they can have coverage. So now, if these people are not going to the doctor on a regular basis, and they're just making emergency room visits, and now they don't have Medicaid, that is going to be a harbinger on our healthcare system. And our hospitals will not get paid for providing care. And you're going to see an uptick in people going to the hospital because they don't have coverage. That's going to make it even worse. They're saying that, health policy experts have warned that the cuts could harm rural hospitals and doctors who serve a higher percentage of people enrolled in Medicaid, which is what I just said. You're going to see hospitals depend on Medicaid and Medicare reimbursements, not just private indemnity insurance like Blue Cross Blue Shield, United Healthcare. At least 1/3 of their billable hours and their reimbursement is through state and federally funded healthcare, which is Medicaid and Medicare. You had a guy here, Pollock, who said that still hospitals are deeply disappointed in this. And this bill that cleared the Senate, said Rick Pollock, President and CEO of the American Hospital Association trade group. He said this is going to deleteriously affect the hospitals from a financial standpoint. Polak said the $1 trillion in Medicaid cuts would cause irreparable harm to our healthcare system and reduce access to care for all Americans. So there's a psychological and a physical result behind this. Poor people have a fear of hospitals and doctors, don't want to go, but at least they have coverage. Now, if they don't have coverage, them not going is being reinforced by not having insurance. And what will that lead to? A higher propensity for deaths, mortality rates, people letting their diabetes, their undiagnosed and untreated diabetes, undiagnosed and untreated high blood pressure, heart disease. You're going to have individuals that are going to unfortunately drop like flies. And that is going to be a sad scenario. Help us, Harris. So I'm not in favor. I think Donald Trump is making a huge mistake, and we could literally lose 10% of our volume of American citizens just based on if this situation with these Medicaid cuts go into effect. This gentleman, Pollock, also said that hospitals may be forced to cut services and staff, and patients could face longer wait times in emergency rooms because you're going to have a higher preponderance of individuals going to the emergency room because they haven't been getting primary care, internal medicine care on a regular basis. He says some rural hospitals and facilities in underserved communities could close. But that's not only where it's going to affect hospitals. What about our urgent cares? There are many people, urgent cares, I think, fulfill a viable, necessary need because there is a certain segment of society that has a fear of hospitals. They think sometimes it can be one way in and no way out. But urgent cares, not as big, not as trepidatious or as intimidating to individuals. People will go into an urgent care, and if they have Medicaid, they can be treated. And there is a misnomer. Medicaid is not just for low-income, poor people that don't work. You could lose your job. Medicaid is a service that's been provided and funded by the taxpayers. You have a right to it. So you could have worked at a place for 25 years, 20 years, 15 years, lost your job and be in between jobs. Remember, this is a new day and time with artificial intelligence, technology advancing, most companies getting rid of pensions. Nobody is staying at one job for 30 years anymore. And companies are much quicker to fire you than hire you. So if you're in an unfortunate situation where you might be out of work for a year and a half or 2 years, Medicaid is a supplement that you can have to make sure while you're worrying about your job and your finances and paying for your house note and taking care of your family, you can still have coverage health-wise. Just say you lose your job and you have a history of high blood pressure or diabetes. Medicaid is a service, here again, it's paid and funded partially by the taxpayers, and we have a right to it. So it's just not for people that don't want to work. That is a misnomer. Um, it also talks about Dr. Richard Besser, the president and CEO of the Robert Wood Johnson Foundation. He said the cuts to Medicaid and a federal food assistance program, which is food stamps, will make our country sicker, putting children at risk of going hungry and make it harder for families to afford basic necessities. So there again, remember, Medicaid and food stamps go hand in hand, especially if you have children. And if you don't, you can be a single adult who's in between jobs. You could be 50 years old, 55 years old. And the state has these services where you can get health care coverage and you can get food stamps to make sure that you have food in your refrigerator. All of this is going to be affected by this so-called big beautiful bill, which is a big beautiful nightmare. And they're talking about you're going to have a twice a year eligibility, which is going to make it more cumbersome, which is going to add administrative costs to this certain scenario. While Trump is saying he's trying to make cuts, he's going to have to add staff. That is counterintuitive to the words that is coming out of his mouth and what they're going to have to actually do. We need to really raise our voice and look at this legislation, and we need to make our Congress people and our senators accountable, and this does not need to pass. We've got enough going on in the world between natural disasters, this immigration scenario, the border issue, the Ukraine and Russia war, the situation in the Gaza Strip, all of these things, those wars we are partially funding. And while we're trying to take care of people outside of our borders, it doesn't seem like our U.S. government and our president is trying to take care of the people inside the United States. And it also mentions that in this KFF survey found that nearly 2 in 3 people on Medicaid, as I said before, there is a misnomer that people that are on Medicaid are lazy and don't want to work. That's not true. A KFF survey found nearly 2 in 3 people on Medicaid are employed either full-time and or part-time. So you can have a full-time job and still get Medicaid. That does not mean that you don't want to work, or you're lazy, or you're trying to live off of the taxpayer's dollar. States will need to prepare for smaller Medicaid payments from the federal government, while adding the extra administrative duties of verifying an enrollee's work or volunteer status. The other part that it's going to affect, so it's going to affect doctors' offices, hospitals, urgent cares. But here's the other part that we're not thinking about, and it could happen to any of us. It is going to affect Health and Human Services, HHS. What falls under that umbrella? Where we're talking about assisted living, we're talking about residential care facilities, assisted living facilities, nursing homes, you're talking about senior living, all of that falls under that kind of umbrella. And I myself and my family have owned, we were in the residential and assisted living business for a very long time, and I know a lot about that. For a resident to live in your residential or assisted living or nursing home facility, generally they are on 2 types of systems, medical systems. If they're under 65, they will have Medicare for their disability, which generally, whether it's psychiatric or physical, will pay them between $900 to $1,300 a month. And then there's this thing called activities of daily living, ADLs, or personal care points, that can, in the state of Missouri, you can add up to 300. That's part of the Medicaid payment. So a facility will get the $1,300 on the Medicare, but it's in many of these facilities, it costs $3,000, $4,000, $5,000 a month to care for each resident. because you're talking about you're doing everything for them. You're washing their clothes, you're bathing them, you're feeding them, you're passing their meds, um, you're having community activities for them, some outings, community resource program, and room for them. All of that, all of those things cost money. So these people cannot take care of themselves in these assisted residential care, let alone nursing and skilled. And if these cuts are going to take place in Medicaid, these facilities will go out of business. Many of these individuals in these residential and assisted living facilities don't even have any family, or they have family that can't take care of them, or don't want to take care of their relatives. And there is a large segment in our society that need to be living in these residential assisted and nursing home facilities, whether a person is paralyzed, ambulatory, uh, wheelchair bound. These facilities need to exist. And I think if these Medicaid cuts take place, you are going to see a very drastic uptick in mortality, in deaths, in homelessness. These facilities will not be able to exist without these Medicaid payments. And so you, what are the places, here again, follow me 100%. These Medicaid cuts are not only going to affect these individuals personally, it's going to affect the hospitals, it's going to affect the doctor's offices, it's going to affect the urgent cares, it's going to affect the residential care, the assisted living facilities, the skilled nursing home facilities. These facilities, and when you're talking about, say in hospitals, they are dependent on 1/3 of their income to come from Medicaid or Medicare. Let's just use that number for example. In these residential assisted living and nursing home, it may be as high as 75% or 80% of individuals that are dependent on Medicaid, Medicare, etc. So you're going to see a trickle-down effect through these cuts that I'm telling you, it's going to affect and decimate maybe 20%, 10 to 20% of our population. Medicaid is the primary payer for 63% of nursing home facilities. 63% for residents, and an additional 13% rely on Medicare as their primary payer. So even those facilities will be fragmented and broken. We need to have a wake-up call, and we need to make sure that this so-called big beautiful bill gets killed and destroyed, because if it goes into full effect, it is going to turn into a big, terrible nightmare. If we care about our family members, and any of us can end up in a situation, you could have an accident in a car, get run over by a car, and end up ambulatory or in a wheelchair, and end up in a nursing home situation, and may have not worked long enough to have a pension or a nest egg. You could be 30 years old, you could be 60 years old, and may not have had enough money in your retirement to take care of your medical benefits. And if these Medicaid cuts go into effect, who and how will these individuals be taken care of? Tell me what you think. This Trevor Donald Experience is a video channel to raise your level of consciousness and exposure. Reading and learning is the vestibule to your freedom. If you enjoyed my commentary, please watch my videos. I did a video on this. Please hit the like and share, and subscribe to my channel. I will be starting to do more lives now, and trying to interact with the people out there, and let's try to help push this channel forward. It is an educational, is no buffoonery. I am an educated man in midlife, and who has raised his children, had been married before, and highly educated, and want this world to be a better place. And I want us to manifest our truth in a positive, righteous, and hopefully a God-fearing way. This has been the Trevor Donald Experience, and let's kill this bill, this big, beautiful bill, which can turn into a big, beautiful nightmare. Thank you for listening, and check me out later.